Welcome to Pathways 101. What is Pathways Community-Based Care Coordination? Pathways Community-Based Care Coordination is a system designed to help people in the community to better connect with the services they need. This happens by empowering people from the same communities to serve as the connectors to services. Community-based care coordinators, often community health workers, are trained to know what services are available and how to assess and understand what services a person needs. Community-based care coordinators look at everything that is getting in the way of good health outcomes: access to health care, housing, employment, safety, education, because it all matters. These barriers to health, or risk factors, are identified and translated into pathways. Each pathway represents one risk factor and the steps that need to be taken to eliminate the risk. There are 20 core pathways: adult education, behavioral, developmental screening, developmental referral, education, employment, family planning, health insurance, housing, immunization screening, immunization referral, lead, medical home, medical referral, medication assessment, medication management, postpartum, pregnancy, social service referral, and tobacco cessation. One of the primary objectives of Pathways is to find individuals who are at risk for poor health outcomes. Because the work is tracked electronically, Pathways can help measure success at eliminating risks and helping people with what they need. The first step is for a community-based care coordinator to engage individuals and complete a comprehensive risk assessment. This assessment, or initial checklist, is used to look at all of the pathways that need to be addressed. Then, the community-based care coordinator partners with the individual to work through all of the relevant pathways. For example, a community member is identified because she does not have any place to go to find a medical provider. She would be assigned the medical home pathway, and that pathway would not be completed until her community-based care coordinator confirms she made it to the appointment. At times, for whatever reason, not all pathways can be completed. If that's the case, then the pathway is closed as finished and complete. Even though the outcome was not achieved, all of the work and effort involved to complete the pathway and the reason why it couldn't be completed is still recorded. This is valuable information that helps build a bigger picture of what is and what isn't working within our community. A final and important piece to Pathways has to do with how the services are funded. Community-based care coordinators and their agencies receive at least 50% of their payment from completing Pathways, which motivates them to make sure the work is fully done. A completed pathway means that an identified risk factor has been successfully addressed. This payment for outcome methodology is important to the overall success of the Pathways Community Hub model. What is the Pathways Community Hub model? This will be discussed in our next training video.